Good morning and welcome to Village in Motion. I'm Marcia Boyles, and I'm delighted to begin this segment by introducing Dr. Dar, who is the director of our Green Spring Medical Center. Welcome, Dr. Dar.
Good morning.
I am just delighted that we're having this opportunity to speak this morning. Clearly, this is flu season, and with the coronavirus also very much in the news these days. I think we're all very interested to know how the medical center is going to be coping or helping us cope with both.
Yes, it is really very timely discussion about coronavirus and flu virus. Most of the years during this time, we are concerned about the flu virus, and we are still concerned about the flu virus because this is the main thrust of viral infections, starting from November up till March. But unfortunately, because of the current situation of new virus which appeared in China recently, called coronavirus, that is causing a lot of trouble all over the world. It is our main front now, in addition to fighting with the flu virus, which is yearly, drill. Fortunately, both coronavirus and the flu virus management is almost, preventive management is almost the same. For flu virus, we have few extra things which we can do which are not available for coronavirus. Flu virus, we have vaccination available, so we start vaccinating our residents in September, and by that time around 80% of the population is already vaccinated. So there is some protection. There is not 100% protection with the vaccination, but it gives vaccination against most of types of flu viruses that can affect human beings according to old records.
Is it a particularly virulent strain this year?
Yeah. Initially, there was some reports that it was only influenza A virus mostly effective. But fortunately, we do not have a very strong flu season in our geographical location, and we are fortunate enough to have very limited number of cases in Green Spring. We have treatment available, which if it is given within effective time of within 48 hours, then somehow it protects against the severity of the flu.
Now, you're speaking of Tamiflu?
Tamiflu. The coronavirus, unfortunately, do not have any vaccination because this is a pretty novel virus which came from coronavirus itself is around for a long time, but this is a special strain of the virus which was not visible before. This is a new finding, and it is suspected that it transferred from the animals to the human being. We are still learning. There is no vaccination for this. There is slight difference between coronavirus and flu virus. Technically, flu virus has a short incubation period. It means that by the time the virus affects a person and by the time the symptoms are visible is about 2 to 5 days. But in coronavirus, it's 14 days. So 14 days of symptom-free period, a person not even aware that has been infected, going around socially and causing spread of this virus. So this is a problem. Otherwise, there is no Tamiflu or any other antiviral medication effective against coronavirus. So all we have is management conservatively. Fortunately, coronavirus, so far we have around 95,000 cases all over the world, but around 80% of the cases are mild and patients got better and are fine. But around 15% of the cases show some severity to be hospitalized, and out of that 5% are more severe. It started from China, then it spread to South Korea and Japan, Italy, Iran, and now it's almost all over the world, unfortunately. It came to the United States also, and we have, I think, 11 cases in Washington State. In our geographical location of Maryland, Virginia, we don't have any positive case of coronavirus. Now, how are we dealing with this as far as the Green Spring is concerned? Green Spring, as a part of the Erickson, larger community.
We've noticed.
Yeah. So we have been having extensive communication with the local health department and the CDC. And what
Erickson Corporate has been having discussions?
Every day.
Okay, all right.
Every day. Yesterday there was an almost 2-hour discussion. Today again there is going to be a specific discussion regarding coronavirus. So we are having this every day. Every day. Not only that, we are fighting this virus on multiple fronts. One front is care and prevention against this virus for our residents. This is the first priority. We have around 2,000 very special residents here in Green Spring, so this is our responsibility to take care of their health. So we are working on that part, and medical center is a very strong pillar for the fight against this virus.
Yes.
Luckily, fortunately, we do not have any case, so we will keep working, fingers crossed that nothing will happen, but we are very strongly vigilant and we have a full protocol. What are we suggesting? We are suggesting to the residents that do not panic. Do not be worried about the mask. At this moment, there is no need to put a mask outside and walk, because the idea is that because of this, fear, the people who really needs this mask are unable to get it because other people who do not need it are buying it and keeping it. So we request to the residents to not be worried, but be careful. The best advice is to cut down the socialization. It doesn't mean that isolate yourself. If you do not have any symptom, you do not have travel history, you do not have any contact with the person who had coronavirus, if you do not have any connection to a person who had contact with some person with symptoms of coronavirus or travel outside the United States, you don't have to worry. If you are concerned, give a call to the medical center. Do not walk in, because minimizing exposure is this is our biggest tool. So we suggest that if you are concerned or if you have any symptom, call the medical center.
Now, Dr. Dar, that would be for both the corona and the regular flu.
Regular flu.
Please don't come to the medical center.
Don't come at the medical center. When you call to the medical center, what will happen to you? We have prepared a special questionnaire which we are going to ask you. The idea of that question is to find out the high risk population that we need to be concerned of. And if we find out that you are one of the high risk person, then we will advise you further as advised by the health department, and we will manage that.
All right, okay. So call, and I think that's a really critical message, isn't it?
Yes.
For residents. Don't come to the medical center, call. They will bring you a questionnaire.
And based on
immediately, I assume.
And based on questionnaire, we'll try to identify the high-risk persons, and then we'll deal them accordingly, according to the recommendations of the CDC and health department, which are already there, and we are all aware of that.
Okay.
If you feel like it, that I need to be tested for the coronavirus or flu virus, let me tell you that we can test you for flu virus, yes. Hospitals can test you for flu virus, but there is no guarantee if you go to the hospital or an acute place and ask for testing to be done for the coronavirus, probably they will not be able to do that. because coronavirus testing is being managed by the health department, and not all the facilities, not all the hospitals are doing that yet.
Does Fairfax Public Health Department have tests?
Yes, Fairfax Public Health Department has it, and they, based on our communication with the residents and after evaluating all the situations, they can do the testing whenever it is needed.
All right, but they would use your questionnaire answers to evaluate the need for it?
Yes.
Okay,
yes.
so they would be the ones that were in charge of the test?
Yes, for now. But again, the situation is so fluid that when I talk to the health department, they tell me by this time, 11 o'clock, this is the recommendations. So these recommendations are changing as the more resources are getting available and more information is available, things will change. But till now, it's advisable to contact the medical center, and we are available here.
All right. Okay. All right. That makes sense. This, I think, begins to put it into a context about what Green Spring is doing, and the fact that there is communication with CDC and the health departments.
Yeah, and you know the other part which is very strong is that it's a large community. There are not only residents, the same number of employees are here.
Yes.
So we are working hard to safeguard them, identify any source which can bring a virus into the community. And so our employee wellness center is very busy so we are advising our employees, we are advising our residents. These are the two main front, and then the third front is the prevention of the disease. So in order to prevent it, Ericsson is adopting all types of antiseptic precautions. They are cleaning everything with proper tool and proper chemical. This virus, coronavirus, can be eliminated with any solution containing more than 60%. It's mean apply locally, not drink.
Oh my, yes. You would not want cases of drinking bleach or
Yes, yes. And there are special bleaches which they are using it. And
well, you know, my recollection, I had a public health course on food handling, and my recollection is that plain old Clorox is about, I mean, diluted, of course, is about as effective as anything.
Yes, yes. So my take-home message is do not get panic. Wash your hands if you go to the restroom. If you get out of the restroom, you go for eating, wash your hand, come out, wash your hand. Avoid handshaking, avoid, too much physical contact. This is a time to say hello.
Rather than hugging.
Yeah. And
now, are dining rooms, for example, now going to go into that mode that they did?
They are already.
Oh, are they?
They are doing whatever according to the standard. We have a special protocol, and based on the number of patients or number of cases, that protocol changes. And according to the protocol change, severity of the disease, a protocol of cleaning, protocol of prevention, everything change.
I see.
So we follow a very strong guidelines developed by the Ericsson based on CDC and health department.
I see. So there are different levels.
Yes.
Oh, that's interesting. All right. Well, I think many of us that have been here for a few years have been through at least one episode of this.
Yes. Yes. But I think this will be the last. I hope.
We could all hope.
We can all hope.
Well, Dr. Dar, this has been extremely helpful. Anything else you'd like to add before we close down here?
Well, medical center is on the forefront. Our doctors and our nurse practitioners are fully aware. We have multiple meetings. Almost every new information which is provided from the Ericsson or the health department or CDC, we immediately convey to our not only our providers but also to all the other staff.
All right, and that also would include Garden Ridge.
Yes, Garden Ridge. Garden Ridge.
Is Garden Ridge taking any particular precautions right now?
All the precautions according to the guidelines, yes.
Okay,
Yes.
all right. Are there respirators over there?
There are respirators, and we
thought
are
there
going
were.
through the respirators. There are special guidelines. These are you need to have special, they want to make it sure that it fixes your face properly, and in order to wear the mask, there is certain guidelines. So everybody is not fit to have and wear the respirator, because the respirator, sometimes if you have some underlying diseases, it's better not to use it. So, we have respirator here, and we are evaluating the providers, all the staff who will be wearing it, and everybody will get a mask, and if needed, we will use it.
All right, all right. And you are prepared to put people in isolation if need be at Garden Ridge?
Absolutely. If somebody has symptoms and based on our evaluation, we deem, we feel like it that this is in the best interest of the community and the patient himself, that he should be advised to stay in his apartment, we will advise him. But again, this will not be without advice of the health department.
Okay.
Health department will be involved, and we will take care of all the precautions, whatever is needed.
Are your staff over at Garden Ridge trained in techniques for isolation?
They are trained, and they are being trained. And
Now?
Yes, and they are trained, and because the situation is evolving, we are not at the point where we start using respirators or all the PPE, preventive kits. But we are aware, we know how to use it, and
All
we
right.
are being trained at this time.
All right, so you're gearing up already.
Yeah, we didn't have any reason to use it. We don't have it now. If there is any point we need to use, we will be fully prepared.
All right, that's very reassuring. All right, so you are in preparation. You are preparing your staff. You're preparing the residents to the best of anybody's ability at this point.
Yes,
And
I assure you that Erickson is actually one step ahead of every community, and they are really concerned. They have full protocols. They are in communication with all the important advisory, organizations, and we will use all our resources for prevention of this disease.
All right. Again, Dr. Dar, many thanks for your comments today. This has been reassuring and very helpful.
Thank you.
Thank you.